Imagine you feel an unusual pain in your stomach, or you lose appetite. You go for a routine checkup, nothing serious, and then you hear you only have 3 months left to live. This is the brutal reality for many diagnosed with pancreatic ductal adenocarcinoma, or PDAC. PDAC isn't the most common cancer, but it is one of the deadliest. In New Zealand, only 16% of patients survive past a year. One promising treatment for cancer today is ICI immunotherapy. Our immune system has tumor-killing guards called T cells, but cancer is a master of disguise, slipping past unnoticed. ICIs act like special vision goggles, letting T cells see through the disguise and attack, and in many cancers, it's worked brilliantly. But PDAC resists almost every treatment. It doesn't just hide, it builds a fortress wrapped in fibrous barricades and guarded from within by traitorous pro-inflammatory cells that trick our immune guards into thinking there's nothing wrong. So what now? Enter bacteria. Some may tip the balance, either fueling the fight or feeding the fortress. I've identified 2 bacterial species of interest. Question is, will they help or hinder the attack on PDAC's fortress? In my research, I will build 2 miniature 3D models of PDAC, not with plastic or computers, but with living cells. First, I will grow PDAC cancer cells into tiny spheres called spheroids and wrap them with fibroblast cells to recreate the tumor's infamous barricades. My second model uses patient-derived organoids, similar to spheroids but more complex, grown from patient tissues made available to researchers. I will be working with 3 organoid lines representing distinct tumor mutation profiles. Now for our soldiers. I will isolate immune cells from donated blood samples and mix them with our 2 bacterial species. They mingle, strategize, and prepare to infiltrate the spheroids and organoids. Finally, I'll compare the battles with and without bacterial support by seeing how many immune guards breach the walls and how effectively they destroy the tumor inside. Molecular markers let us watch the fight at a cellular level. We hope these microbes act as allies, sounding the alarms, ousting the traitors, and enabling the ICI-powered T cells to take down the tumor from within. This isn't just about better medicine, it's about rewriting the battlefield, turning silence into signal, and unleashing the immune system to increase the chances of survival for one of the most resistant cancers, known as PDAC.